I plan to use my undergraduate psychology major in the field of chemical dependency. Substance abuse and behavioral disorder counselors. A substance abuse and behavioral disorder counselor have many different titles, but they all offer the similar types of treatment. Most of these jobs are in a clinical, hospital, or inpatient type of setting. Addiction therapist, behavioral therapist, chemical dependency counselor, correctional substance abuse counselor, residential treatment coordinator, licensed clinician, and student counselor. Summary job description is to counsel and advise individuals with alcohol, tobacco, drug, and other problems such as gambling and eating disorders. Many counsel individuals, families, or groups or engage in prevention programs. Candidates with an associate's degree in the field related to behavioral health, such as psychology or substance abuse counseling, need only 2 years of experience. Substance abuse and behavioral disorder counselors, also called addiction counselors, will work with clients individually and in group sessions. Many incorporate the principles of a 12-step program, such as Alcoholics Anonymous or AA, to guide their practice. They teach clients how to cope with stress and life's problems in ways that help them recover. Furthermore, they help clients rebuild professional relationships and, if necessary, reestablish their career. They also help clients improve their personal relationship and find ways to discuss their addiction and other problems with family and friends. Special circumstances. Some counselors work with clients who have been ordered by a judge to receive treatment for addiction. Others work with specialized populations such as teenagers, veterans, and other people with disabilities. Some specialize in crisis intervention. These counselors step in when someone is endangering his or her own life and the lives of others. Other counselors specialize in non-crisis interventions, which encourage a person with addictions or other issues to get help. Non-crisis interventions often are performed at the request of family and friends. Patients that fall under these special circumstances are often ordered to participate in substance abuse programs and are not typically very enthusiastic about it. Many times they are angry, defiant, and non-compliant. As an abuse counselor, it is your job to help these clients become more involved with their own recovery and care. Income ranges for Washington State and surrounding areas such as Oregon, Idaho, Montana are similar in pay rate. Changes increase or decline depending on how populated the area is. All guidelines are average. Certifications allow for advancements of salary ranges in levels. These range in levels of 1 through 5 and are typical for wage increments when advancements in career occur. For the Wenatchee Valley, for example, a level 3 counselor in a treatment center average is about $17.64 per hour, or just a little over $36,000 per year. Job tasks and duties. Complete and maintain accurate records or reports regarding the patient's histories and progress services provided and or other required information. You write reports and evaluations and you maintain the client records. Develop client treatment plans based on research, clinical experience, and client histories. Develop treatment plans for patients and clients. Interview clients to gather information about their backgrounds, needs, and progresses. Collaborate with other professionals to assess their clients' needs. Another is to counsel clients or patients individually or in group sessions. To assist in overcoming dependencies, adjusting to life, and making changes in their life. Counsel clients and patients with substance abuse issues. Modify treatment plans to comply with changes in client status. You want to modify treatment plans to accommodate for those clients' needs. More jobs, tasks, and duties. Participate in case conference or staff meetings. You want to collaborate with others, professionals, to assess client needs and plan treatment. Develop, implement, or evaluate public education, prevention, and other health programs. Working in collaboration with organizations, institutions, or communities. Evaluate the effectiveness of counseling and educational programs. Plan programs, address community issues, collaborate with other professionals to develop education and assistance programs. Counsel family members to assist them in understanding and dealing with and supporting clients or patients. Work objectives: communicating with supervisors, peers, or subordinates. This will provide information to supervisors, coworkers, and subordinates by telephone, in written, email, or in person. Establishing and maintaining interpersonal relationships. You'll develop constructive and cooperative working relationship with others and maintaining them over time. You'll be documenting and recording information. Entering, transcribing, recording, storing, or maintaining information in written or electronic magnetic form. Getting information. You'll observe, receive, and otherwise obtain information from all relevant sources. Assisting in care for others, providing personal assistance, medical attention, emotional support, and other care to others such as coworkers, customers, and patients. Evaluating information to determine compliance with standards. Using relevant information and individual judgments to determine whether events or processes comply with law, regulations, or standards. Resolving conflicts and negotiating with others. Handling complaints, settling disputes, and resolving grievances and conflicts, or otherwise negotiating with others. Relevant course of study. Experience. Extensive skills, knowledge, and experience are needed for these occupations. Many require more than 5 years of experience. Education. Most of these occupations require graduate school. For example, they require a master's degree and some require a PhD, an MD, or a law degree. Training. Employees may need some on-the-job training, but most of these occupations assume that the person will already have the required skills, knowledge, and related experience and/or training. Desirable skills. Active listening. Giving full attention to what others are saying, taking time to understand the points being made, asking questions as appropriate, and not interrupting at inappropriate times. Speaking. Talking to others to convey information effectively. Social perceptiveness. Being aware of others' reactions and understanding why they react the way they do. Reading comprehension. Understanding written sentences and paragraphs in work-related documents. And critical thinking. Using logic and reasoning to identify the strengths and weaknesses of alternate solutions, conclusions, and approaches to other problems. More desired skills and abilities. Oral comprehension, the ability to listen to and understand information and ideas presented through spoken word and sentences. Oral expression, the ability to communicate information and ideas in speaking so others will understand. Written comprehension, the ability to read and understand information, ideas presented in writing. Written expression, the ability to communicate information and ideas in writing so that others will understand. Speech clarification, the ability to speak clearly so that others can understand you. These are CDP requirements, or also known as chemical dependency requirements. You must obtain a bachelor's degree in dependence counseling, have at least 30 hours of credits in the following: understanding addiction, pharmacological actions of alcohol and other drugs, substance abuse and addiction treatment methods. There's also a section in there for disabilities and its applications towards treatment. You'll have chemical dependencies counseling for families, couples, and significant others. There's relapse prevention, adolescent chemical dependency assessments and treatment, chemical dependency case management, and case dependency rules and regulations. You have to pass either the National Association of Drug Abuse Counseling, or NADAC, or the International Certification Reciprocity Consortium, a level 2 exam, and accumulate 2,000 hours of supervised work experience. Freedom of choice. Many of today's treatment programs and services are based on the theory of choice. Choice theory psychology is a new explanation of human behavior that was developed by Dr. William Glasser, MD, known as the 10 axioms of choice theory. The only person whose behavior we can control is our own. All we can do is give another person the information. All long-lasting psychological problems are relationship problems. The theory of choice theory is based on everybody has a choice of what they want to do. If they don't want to do therapy or chemical dependency or anything like that, they don't have to. They have that choice. Even when jail is the only other option, they have a choice of either seeking treatment and avoiding jail or going to jail, which isn't necessarily the best way to go. But everybody has a choice on what they can do.